Jump In Foundation has been created to help individuals who are in need of our services either because they're living in poverty and may be at risk of developing mental illness, or they suffer from mental illness but don't have access to the kinds of activation resources that could very much help them recover and get back to a more active way of living. So we've helped people in a variety of ways. We've helped individuals who don't suffer from mental illness but live below the poverty line and are interested in engaging in sports such as sponsoring an athlete to be on a varsity team or sponsoring young people to be involved in activities such as karate. Another group of patients which have been referred to us from St. Joseph's Hospital Psychiatric Services are patients who suffer from mental illness and have family members who also suffer from mental illness. And we've involved those individuals and their families in a variety of activation programs to help them, number one, recover from mental illness, but also get back on their feet so they have a more active lifestyle. As the medical director of emergency psychiatric services at St. Joseph's Healthcare in Hamilton, Ontario, and as an acute inpatient psychiatrist, it's been easy for me to identify that our current psychiatric programs lack the resources and focus and diversity that's necessary to provide the best care and opportunity for all of our patients suffering from mental health issues. The goal of the physical activation program is to develop and design programs that are specific for each individual client. The programs are designed to help them participate in physical activities which are aimed at improving their mental health. For example, individuals that suffer from agoraphobia or social anxiety may be avoidant of getting out of the house or getting on the bus or participating in athletic programs. And this avoidance and these limitations can worsen and exacerbate all sorts of mental health issues. Lots of times, the people who need these kinds of programs the most are the least able to afford those kinds of programs. The Jump In Foundation works to break down these barriers to participation. The Physical Activation Program that's sponsored by the Jump In Foundation is a program that's designed to assist individuals who have mental health disorders in their recovery. These individuals may suffer from a mood disorder, an anxiety disorder, or a concurrent disorder, and the activation programs that we select for each client is designed specifically for him or her, and it's based on their own interest and fitness level and their personal goals. The idea is to help each of these individuals return to a state of mental well-being, physical well-being, and get back on their feet with a more active and enjoyable and healthy lifestyle. Our individual and group activation program is run by Laura Tricoli-Ormond, who has coached and provided encouragement at a variety of levels through a variety of activities such as basketball, personal training, tennis, and now as a retired recreation coordinator after 35 years, she has devoted her time to activating our Jump In clients and getting them involved in a variety of community activities. Our clients have been referred to us through various psychiatric programs at St. Joseph's Hospitals, through other foundations, and through a variety of individuals who have contacted us to request support for individuals in need. The individuals who participate in our programs either suffer from a variety of mental health issues or struggle with the disadvantage of living below the poverty line. The mental health issues we have assisted people with include a variety of anxiety problems like agoraphobia, panic disorder, social anxiety, from addiction issues, and from complex personality difficulties. All of our clients live below the poverty line and thus without the support of the Jump In Foundation would not have access to the equipment, the coaching, and the programming that we provide. We have provided bicycles for entire families, tennis rackets, running shoes, and all of the equipment these individuals need to participate in the programs of their choice. But it doesn't stop there. We just don't provide the equipment. We also provide the encouragement and support in getting them out of the house and returning again and again to these programs. Currently, we have clients between the ages of 13 and 65. These are clients who've built a solid relationship and trust with our team. We are very proud to have developed a partnership with the Hamilton Rosedale Tennis Club This partnership allows our clients to play tennis at any time when the tennis club is open at no cost. And our excellent tennis professional, Taylor Ormond, who works with the Jump In Foundation, is currently articling in one of our Hamilton law firms. Taylor had gone to the United States on a tennis scholarship and is a superb tennis player. She enjoys working with young people and getting them involved in fitness and competitive sports. So we're very grateful to have Taylor and our partnership with the Rosedale Tennis Club. Just one added point, of course, the Jump In Foundation provides all of the equipment and instruction for its clients who choose to do tennis. We've also developed a partnership with the Kripa Foundation, which is an international yoga foundation. It started in India and is currently working in many countries. Their focus is teaching yoga and mindfulness to assist individuals who are dealing with addiction and other aspects of mental health issues. Currently, one of the Kripa Foundation yoga instructors, Jim Pope, is teaching yoga at St. Joseph's Hospital on one of our acute inpatient units. And Jim is a phenomenal resource in assisting our clients to gain a greater understanding of the mind-body link and how we can use our mind to heal our body and vice versa. We encourage our clients to choose a program that they feel most passionate about. Many of our clients try many activities before they settle on the activity that is most gratifying for them. For example, we have given support for some of our clients to participate in martial arts. Others have signed up for tennis. Some are enrolled in city recreation programs such as Zumba or cycling or swimming. As well, we've purchased a variety of athletic equipment for various GIF participants, such as bicycles, bicycle helmets, running shoes, tennis equipment, etc. Some of our clients have enjoyed the Zumba classes, which are organized by the Hamilton Recreation Centers. These classes are an adjuvant to other activation programs which are put in place for them, such as cycling and tennis or even walking. The Zumba classes have been very popular in recent months. One of our most active Jump In Foundation clients joined a local YWCA to participate in swimming classes, yoga classes, various fitness classes, in addition to cycling and tennis. This has changed her life.
My name is Courtney. I'm a 36-year-old agoraphobic bipolar woman. I was introduced in the Jump In Foundation through Dr. Patterson at St. Joseph's Psychiatric Hospital. This program has given me the opportunity to be able to leave my house comfortably under the great support of Laura, who's one of the coordinators. I've been introduced to many programs for me to get active and get back out into the community. When I was younger, I was very active and in swimming, and I did many things that a normal young person would do. As I got older, I went through some trials and tribulations that triggered a lot of stress and anxiety within me that did not allow me to leave my house. I was literally, I was jailed inside. I couldn't leave. I was so scared, panic and anxiety. And there's no words to express the gratitude I have towards this foundation. They have given me so much support. And the great thing about this foundation, it doesn't matter what background you come from, or what your education is. It's just an opportunity for you to take a jump forward to change your life, and that's the only thing that you need to belong to this. It's just a desire to want to live a better life, and being active and getting those healthy endorphins going really make a difference. And I went through an incident not too long ago where I was unable to be active, and it really triggered all the things from the past, and I had trouble leaving my house. And the support with this foundation is amazing, and there's no judgment, and it's just this amazing opportunity for people to get together and have fun. And that's all it needs. You don't need to be a professional athlete. You don't need to have any certain qualifications to belong to this. You just need to have the desire to want to change your life. And anybody living below the poverty line, it's very difficult to belong to a program like this. I chose the YWCA as my main main outlet. I enjoy the gym and the swimming. They offer everything there. You can do a variety of things. I'm very grateful towards this program. And again, the beautiful thing is that you don't need to have any qualifications except for the desire to want to change your life. And that's a beautiful thing. It's a great opportunity, and it's a program I believe in, and I'm very grateful for that.
Water fitness has been a particularly popular activity for many of our clients who are just getting back to activation after having a number of physical health concerns such as chronic pain. One client in particular enjoyed the WaterFit classes that were organized by the Hamilton Recreation Center. These AquaFit classes had been designed particularly for clients who are just getting started in their fitness program and or have weight problems, joint problems, and other chronic pain difficulties. We purchased a bicycle for one of our clients, as well as a bicycle helmet, and this became a primary means of transportation throughout the city, allowing her to participate in programs without the cost of a bus ticket, and also providing independence and physical activity, which is also the beginning of her getting back to work. In Canada, an incredibly wealthy Western nation, nearly 5 million people live in poverty. And people living in poverty are more likely to suffer from a mental disability. We know that people living with disabilities as well are twice as likely to live below the poverty line. It's well established that physical activity is beneficial for adults and youth in a variety of ways. This has been well established through decades of systematic research. Physical activity improves our physical health as well as our mental health, and also reduces the risk of developing addiction. Regular physical activity improves our cardiac health, our respiratory health. It reduces our risk of developing metabolic syndrome, which is a complex fraction of diabetes, thyroid illness. And it also improves our sleep, our overall mental health, and our general outlook on life. Physical activity has also been studied as a treatment for mild to moderate mood and anxiety disorders, and it's been well established as both primary treatment as well as adjuvant therapy. There's also good research linking regular physical activity and mental health for children and adolescents. Most recently, there's a recommendation for 60 minutes a day of regular activity for youth, and research links regular activity with improved health, better performance in school, and of course, better physical well-being. Burbach in 1997 was able to demonstrate that physical activity interventions can be a useful treatment when conducted by trained and motivated staff and used in conjunction with other therapies. This study, done in Ireland, also demonstrates the link between physical activity and improved mental health. It provides the specific links between physical activity and the role of recovery in mental health issues. This provides us with a bridge between physical activity and a more meaningful life. This concludes our Jump In Foundation webinar on physical activation. We welcome your inquiries and participation in our program. Thank you for listening.